For those of you that don't know me, my name is Jody Buchanan. I'm a women's health nurse practitioner, and then I also have my um, Menopause Society certified practitioner provider license as well. A little bit about me. I was a nurse for many, many years, worked in lots of different areas, found my home in labor and delivery and women's health. And the longer I was there, the more I wanted to learn. So in 2021, height of the pandemic, I went back to school and got my women's health nurse practitioner. So, um, women's health nurse practitioner, for those that maybe don't know what we do, we specialize in women's health. So everything from periods and birth control all the way to perimenopause and menopause. Um, so from basically when you start your period until the end of life, we cover pretty much everything in between. We also do take care of men as well, just for sexual health and reproduction. So I'm limited that way. So again, welcome. I thank you all for coming. I'm glad you decided to spend a little time with me. I know that everyone is super busy, has lots of things going on, lots of activities. So I appreciate you all spending your time here with me for a little bit this evening. So as the other slide showed, we're going to talk about perimenopause, hopefully give a little bit of information, decrease maybe some of the confusion out there in the world about it. And my main goal is just to provide some details, some education to help women through this transition. Can be a very difficult transition, especially if you don't have any knowledge or anyone to help you through it. So with that, we'll get started. So everyone is here for perimenopause and menopause, right? So what is the difference? There's a lot of women that have no idea, never heard of, no clue what perimenopause is. Perimenopause is just the lead up to menopause. So it's when you start noticing changes. Those changes can be vastly different. It can last up to about 10 years. Most women, about 75%, will have some perimenopausal symptoms. Most generally, it's hot flashes, but we'll talk about the other symptoms later. And these symptoms are due to large hormone fluctuations. Once you reach menopause, which is just simply diagnosed after 12 months without a period, you're considered menopausal. The average age of that in the United States is about 51. Some are before, some are after. So if you think, doing some math, about 51, you're menopausal, 10 years back, about 41, sometimes earlier, you can start having symptoms. A lot of times they catch you off guard because they're very secretive, kind of, what's the word? They're kind of hard to figure out when you're going through it until you've got a little ways down the road. So hopefully this will help any and all of you that may be having these symptoms to know what's going on. And unfortunately, some of these symptoms that you have can continue all the way throughout your lifetime once you reach perimenopause and menopause. So common symptoms. So these may start ringing a bell in your head. So we talked about large hormone fluctuations, and these are the hormones that are involved: estrogen, progesterone, and testosterone. Low estrogen is responsible for your irregular cycles. So when you're in perimenopause, you might start noticing you skip a period, you maybe are late on your period. Maybe it comes early. You have light spotting, and then a couple weeks later, you have what you think is your regular period. Those are all completely normal. You may feel crazy, of course, but those are all completely normal and expected in perimenopause. Hot flashes, like I mentioned at the start, vaginal dryness, and even bone loss. Estrogen is very crucial to bone building and the stability of bone. Progesterone also drops. That can lead to insomnia and fatigue, which then can lead to mood swings. You may find yourself, like myself, in your kid's bedroom and you're wondering, why am I so angry at this moment? Why am I so irritated? Why am I irritable at my husband and my kids? Brain fog. Maybe you are in the kitchen and you think, hey, I need to go grab such and such out of my room. You get to your room and you think, what did I come in here for? That is low progesterone. Along with the insomnia and fatigue, it also will manifest or show itself as anxiety and panic attacks. So, someone that maybe throughout their entire life has never experienced anxiety and panic attacks may start suddenly feeling those symptoms. Completely normal because of the low progesterone. The other very important hormone in all of this is testosterone. Most of the time, we think testosterone, that's the male hormone, is not important. No, it is very important to females just as much as it is to males. So, low testosterone can manifest or show symptoms of low libido or arousal. Maybe you're not interested in your husband anymore. You love your husband, you want to be intimate with him, but it's just not there and you can't figure out why. Low energy and difficulties maintaining or increasing your muscle mass, very common. Some other common symptoms that you may be experiencing is the ever familiar weight gain around the abdomen, that spare tire that you just can't get to go away no matter how much you're exercising, dieting, all of those things. Unfortunately, hair loss as well. Yay, women. Joint pains. You might have what's called frozen shoulder, night sweats, and many, many more. Now, I know this sounds terrible, and it can be for some, but not everyone's experience is all of these symptoms together. Some women don't have any symptoms at all and fly right through like nothing ever happened. Other women can get through most of it and tolerate it, and then there's others that have severe symptoms. So, no matter where you're at in your level of symptoms, again, it's all normal, it's all expected, um, that you will go through it. It's just a matter of how your body reacts to the drastic drop in those hormones. So, a little bit about these hormones that I had mentioned, the estrogen, progesterone, and testosterone. All of these hormones are found in both males and females. Typically, we think of estrogen and progesterone as female hormones and testosterone as male. That's It's true, but not so much because, again, both males and females have all three of these hormones. In fact, very surprisingly, women actually have more testosterone in their bodies than they do estrogen. The reason for that is because our bodies can convert testosterone into estrogen, so therefore we have more. It's just not as much as what males have, so that's the difference there. All of these hormones have direct effects on our bodies. They do drastically decrease in midlife. Men typically will have a gradual lowering, but it is not near what women go through. And because of these drastic drops, that's where all of our symptoms come from. So don't let this slide scare you or get overwhelmed. This is a graphic of a representation of women's hormones, specifically estrogen and progesterone, throughout their life cycle. What I want you to pay attention to, the yellow or that gold line represents estrogen. The blue line represents progesterone. And if you look way over to the right, that is childhood, or sorry, way over to the left is childhood, over to the right is menopause. So as you can see, childhood are those two hormones are fairly stable. They begin to rise through puberty. We have a pretty good spike during puberty. And then we get to the middle section, which is our childbearing years. Our childbearing years, those hormone fluctuations are very large because we're having our cycles, right? As we approach perimenopause, both of those hormones take a drastic dip. And it's because of that drastic dip that we have all of the symptoms that we experience. And then as you see way over to the right, when we get to menopause, when our periods cease, or we have a hysterectomy and we're no longer cycling and having periods at that point, our hormones fall and reach a steady level. So, treatments for perimenopause and menopause are to hopefully soften the blow of that fall. We all, in medicine, we all know that all women will go through this. They're all going to have that drastic drop, but the treatments available are to help soften the fall, if that makes sense. Okay, so I'm going to review the hormones one more time so you can kind of see how it relates back to perimenopause and menopause. So I put these graphics up for the hormones to hopefully help you remember to see what they do in the body. So estrogen is what I like to call the builder hormone. It's responsible for building a baby. It's a grower. It helps to grow the vaginal tissues to keep them plump and lubricated. It helps grow the uterine lining so that that potential embryo can come down and implant, and then you have a pregnancy. It's also very important in growing bones and helping bones stay strong. So when you have a drop in that, that's where those symptoms come that we talked about. Progesterone, I like to call the calm, the protector hormone. My little policeman icon there. It's very important in mood stability. Think if you've had a pregnancy, think back when you were pregnant, that progesterone, it kept your uterus calm and quiet. Your body did not want to go into labor early. So it kept things cool, calm, and collected. It also balances the uterine lining. The estrogen is what grows that lining, but we don't want it to grow too much. And that progesterone is what balances that. Again, testosterone, it's that strength hormone. It helps with muscle growth, with muscle mass, with energy. And then, of course, it's also responsible for libido and arousal and sexual appetite. So again, we'll review this one more time. Hopefully it's going to start clicking in your head if it hasn't already. Because those hormones of what we talked about of what they do, if they go low, again, low estrogen, those irregular cycles, hot flashes, vaginal dryness, bone loss. Progesterone, that calming effect goes away. Anxiety, mood swings, brain fog, sometimes panic attacks. The low testosterone, you're going to have lower energy. You're going to have difficulty keeping your muscle mass. You're going to have difficulty maintaining your weight. Again, that low arousal, sexual appetite is it going to decrease. And then, of course, we talked about the other symptoms that you may be experiencing, the weight gain, the hair loss, all those things. So now that we've went through all that and everyone's pulling their hair out going, what am I supposed to do now? Everything's falling apart. What do I do? Stay calm. We have treatments. There are things available for you that will help. So I divided these treatments up into two categories. The first is lifestyle and supplements. They don't require any prescription medication, and then medications. Those medications can be hormonal, and there's also some non-hormonal out there as well. So if you're kind of on the fence about hormones, don't worry. There's other options out there as well that are not hormonal. So lifestyle and supplements, these are just some examples. As we get older, it becomes more difficult for us to process carbohydrates and especially processed food. That's why we see an increase in diabetes as we get older. So limiting your processed food, changing your diet, trying to eat as well as you can. Those are all going to be great things to do. Of course, strength training, stress management. Who doesn't need stress management in today's world? Sleep hygiene is a big one. What sleep hygiene is things you can do to help get yourself on a regular sleep cycle. Our bodies require a certain amount of sleep for rest. And if you are anxious or you can't sleep because of your hormones, it's going to affect you throughout the whole next day. So examples would be maintaining your schedule. Make sure you go to bed about the same time every night. Make sure your room is dark, it's cool. Make sure all of the blue lights, like your phones that we all like to have next to our beds, make sure those are turned over so that light is not shining in your face. And then, of course, supplements and vitamins. Okay, now we're into the hormones and the medications. So I know there's a lot on this slide. I just wanted to briefly touch on it because I'm not sure the level of knowledge out there. There's a lot of confusion, like I had mentioned earlier. So the Women's Health Initiative was a huge study that was done back in the 80s that they took groups of women, some got hormone replacement therapy, some didn't. They did their study. And basically what it all boiled down to was they gave a bunch of recommendations against hormone therapy. However, those recommendations don't really apply today. So they have went back many times since then, and now they've changed the tune a little bit. And what they have found, the FDA has approved hormone replacement therapy for 4 different things: hot flashes, night sweats, prevention of osteoporosis. And then what I have on there is the genitourinary syndrome of menopause. And what that is, that's a really long word for basically vaginal dryness, increased risk of bladder infections, and pain with sex. Because if your tissues are very dry and irritable, sex is not going to be pleasurable. So that's what that is. That next bullet point, it is safest. They have found it's safest to use in the first 10 years of perimenopause or menopause. However, there is no need to stop. There's no recommendation to stop that therapy because most generally, when you stop the therapy that you're on, all of your symptoms will return. So it's okay to continue using. And then the last 2 bullet points, it talks about the good things from hormone replacement therapy. It prevents bone loss. So if you have a family history of osteoporosis, estrogen might be a good thing for you because it's been proven to reduce bone loss and prevent osteoporosis. With that, fracture risk, that goes down as well. I believe it's 30% of women that if they break a hip and go into the hospital, 30% do not go back home. So that's a um, big mark against women is the fracture risk. It does reduce your risk for cardiovascular risk, and there's a all-cause mortality decrease for everyone using hormone therapy. What that means is that all the diseases out there, all the reasons that would cause a woman to die in perimenopause and menopause, those risks go down, including the risk of colon cancer. So good things. This slide gives the different options available for hormone replacement therapy. Um, there's different terms to talk about hormone replacement therapy. Some people just call it hormone therapy, so don't get caught up in that. But again, there's a whole list of different options to choose from: pills, gels, all of those things. And then I mentioned the non-hormonal options as well. There's a couple of them down there as well too. There is a couple words on here I don't know if you're familiar with: prescription and compounded. The difference between those two: prescription medicines, of course, are going to be at your pharmacy. They're FDA approved. We can use them, um, I don't know what they call it, according to the label, and we can also use them off label. So just FYI on that. Compounded medications are just medications that are not available in the pharmacy. Typically, what they do is they mix different medications together to make another medication that's not available currently at the pharmacy. So just so you have a little bit of knowledge of what that is. Okay, so have you been sitting there scratching your head going, oh my gosh, I am talking to you personally. This is exactly what is going on with me. Yay, I'm so glad you came. And you have found me, and we can hopefully get together, make a plan, and help you with your symptoms. So this is my card. A little bit more about me. Obviously, I work at Sakura. It's Sakura Health and Wellness in Andover. I'm there on Thursdays and then every other Saturday morning. So obviously, I want to have more time at Sakura as things grow, but that's where I'm at for now. So um, the QR code that's on there, that will take you directly to the appointment site. Below that is our website. So you can take a look at that, read about me, look at our different appointments, all the things that we can do. Again, I do everything women's health. So anything from pap smears, birth control, um, polycystic ovarian syndrome, if you're familiar with that, to hormone testing and hormone treatments for perimenopause and menopause. So at this point, I know there's lots of questions. I gave you a ton of information. I know I talked super fast. So the first one that I had here was, how long does it take before you start to feel better if you start hormone therapy? And most generally, I tell my patients That it depends on the person, of course. Every one of us is different. Everyone has different symptoms, but they're all similar. But most generally, I would say probably within a couple weeks, at the very latest of 3 months. What I usually do is if a menopausal, perimenopausal patient comes in, we have a discussion about their symptoms. We talk about the risks, the benefits, the side effects, all those things. And then the two of us make a joint decision of what the patient would like to do. I am here to give you the information, and then you tell me what you want to do. At that point, we start them on their medication if they would like. And then I usually see you back in about 3 months just to check in to make sure things are going well. If they're not going well, obviously you can call me long before that. But the 3 month visit is just to kind of check in, make sure things are going well. If we need to make some tweaks, some adjustments, we absolutely will do that. And also draw lab. If we need to draw lab, we'll do that as well. What else do I have? Oh, does hormone therapy, is it the same as birth control? So I get this question a lot. And no, it's not. It is similar, but it's absolutely not the same. So when we're in our childbearing years and we're thinking about birth control, remember that slide. I can click back to it here, I think, if it'll let me go back. Nope, it's not going to let me go back. Never mind. Remember that slide where it had those huge fluctuations in our childbearing years with the yellow and blue lines? In order to prevent pregnancy, we have to have very high levels of hormones in our bodies to stop us from ovulating, which is one of the ways that it prevents pregnancy. Compare that with menopause when we have that drastic drop and we're basically trying to soften the fall. So I like to compare birth control to a bazooka for hormones, and menopause therapy, hormone therapy, is like a little water gun. It's just a little whiff. So um, similar, but different. The other thing that's also very different about birth control versus hormone therapy, birth control is synthetic, which means that it's made in a lab. It's similar in structure to the normal hormones that our body makes, but it's made in a lab. It's a little different. Hormone therapy is what we call bioidentical, which is the same structure and function as what our bodies make. So that's another difference between the two. And I think I have a couple questions. Let me look here. Yes. So the question is, does the hormone therapy have any impact on hair loss? And the answer is maybe, maybe not. So hair loss and hair is what we call multifactorial. There's a lot of different factors that affect hair loss. If it is just simply hair loss from loss of estrogen, hormone therapy will help because, again, that estrogen is a builder. It's going to help build that hair. Remember when you're pregnant, you had this long, thick, beautiful hair, and then when you had the baby and your progesterone went back up and then all your hair fell out? Same concept. So if your hair loss is specifically from the low estrogen, hormone therapy will help. But there's many different causes of hair loss. Um, just as an example, if you have a drastic weight loss or a very stressful event, say you had I don't know, say you had a parent or a really good friend that suddenly passed away and it was very incredibly stressful for you, that affects your body and your hair. You won't see it immediately, but it's very common. Or if you lose a drastic amount of weight, say you lose 30 pounds in a couple months, about 3 to 4 months later, your hair is going to start thinning. And it's usually in it's a generalized pattern where maybe your ponytail, you could wrap your hair tie around twice before, and now maybe you can wrap it around 3 times. So it's kind of a generalized hair shedding from the low estrogen. But again, there's different reasons for hair loss. So I hope that answers the question. Let's see here. What are some of the negative side effects of HRT? Can you get acne and facial hair? Very good questions. So when we talk about acne and facial hair, that is typically from high doses of testosterone. Think back when you were in puberty and your hormones again are raging. Sometimes we have those crazy acne breakouts. That's usually from the testosterone. So it is possible using testosterone in menopause. However, we usually use very, very small doses of testosterone. There's lots of options for testosterone. There's testosterone pellets, there's gels. I usually like to start with the gel. For men, let me back up. So the testosterone gel, it's only packaged for men to use. However, it's approved for women as well. We just don't have it packaged in a small enough dose for women. So what I do is I'll use, the testosterone gel, and one packet would last a man 1 day. So that same gel, we use it in women for 1/10 of the dose. So that same packet that a man uses in 1 day, a woman would use that in 7 to 10 days. So it's about 1/10 of a dose. It's about a pea-sized amount that you put on your finger and then rub on your skin. So I'm not super concerned with acne and facial hair using testosterone. Obviously, I'm going to be checking and making sure that that's not happening. But the likelihood of that, if we're using a very, very small dose, is pretty low. But again, we're going to be watching that. Usually, if that were to happen, it's going to be several months down the road that you'll see it. If you start it, say, today, you're probably not going to see any symptoms of hair loss or acne or anything like that. If it's going to happen, it's going to be several months down the road. So we're going to be following up, watching very closely, because none of us want that to happen. Okay. The other question that I have that I just want to touch on, if you have any pre-existing conditions like maybe hypertension, high blood pressure, maybe you've had a couple relatives that have had breast cancer, um, maybe you have, I don't know, uh, bleeding disorder, or maybe you've had fibroids in your uterus in the past. Those are all things that when you come for a consultation, we can talk about, and we'll go over risks and benefits and side effects and see what we can work together. Because there might be a way, like I said, there's many options. So there might be a way that we can help you without increasing your risk for other things. The main point that I want to make is that the treatments are out there available for you, and I want to be able to give them to those that would like them. But we always keep in mind risk versus benefit. So with that, I just want to thank everyone again for coming and spending some time with me this evening. I hope everyone got a little bit of benefit out of this. That was my goal. And absolutely, I look forward to working with you if you would like. So thank you all.